My dear friend, if you are reading this, I know exactly how you feel. You've likely spent nights staring at the ceiling, wondering if you'll ever be able to pick up your grandkids again or play a round of golf without that lightning bolt of pain shooting down your leg. As someone who has spent over 30 years in the field of physical medicine and rehabilitation right here in the United States, I have sat across from thousands of patients just like you. They come to me clutching an MRI report as if it's a life sentence. But today, I want to tell you something that many clinics might not emphasize. You are not your MRI. Chapter 1. The Hidden Truth of Disc Healing. In our modern medical world, we have become obsessed with pictures. When you see bulging, extrusion, or sequestration on a piece of paper, it sounds terrifying. However, a landmark study published in the American Journal of Neuroradiology looked at thousands of people without any back pain. They found that 50% of 30-year-olds had disc bulges, and by the age of 60, nearly 80% of healthy people had disc degeneration. What does this tell us? It tells us that structural changes are often a normal part of aging, much like wrinkles on your skin or gray hair. The real question isn't just, do you have a herniated disc, but why is your body unable to adapt to it? You see, a herniated disc becomes a disease only when it causes persistent inflammation and nerve irritation. Many patients struggle for years not because their disc is broken, but because they are stuck in a cycle of systemic inflammation. In the U.S., our high-stress environments and sedentary habits create a biochemical soup in our bodies that prevents the disc from healing. Think of your disc like a jelly donut. When the jelly, nucleus pulposus, leaks out, it's not just the mechanical pressure on the nerve that hurts, it's the chemical irritation. The jelly inside the disc is highly acidic. When it touches your nerve root, it's like dropping lemon juice into an open wound. Your body's natural response is inflammation, a biological fire meant to clean up the mess. But when that fire doesn't go out, it turns into chronic pain. Scientific evidence from the New England Journal of Medicine shows that in many cases, conservative management, focusing on nutrition, correct movement, and psychological resilience, is just as effective as surgery in the long run. The body has an incredible built-in mechanism called macrophage-mediated resorption. These are specialized cells that act like a biological Pac-Man, literally eating away the herniated material over time. But for these Pac-Men to work, your body needs the right environment. Many people fail to heal because they treat the back like a mechanical hinge that needs oiling, rather than a living, breathing ecosystem that needs nurturing. They jump from one quick fix to another, injections, adjustments, or fad supplements, without addressing the root cause, the failure of the body's natural resorptive process. Throughout this series, I want to guide you back to the basics of biology. We will look at how the American diet, filled with inflammatory seed oils and sugars, is keeping your nerves on fire. We will discuss why absolute bed rest, once the gold standard of treatment, is now considered one of the worst things you can do for a herniated disc, as it starves the disc of the movement-based nutrients it needs to repair. I want you to take a deep breath. Your spine is one of the most resilient structures in nature. It is designed to heal. The fact that you are seeking knowledge today is the first step towards that healing. You are not broken. You are simply in a state of imbalance. Together, through the Goodbye Back journey, we are going to extinguish the fire, feed the repair process, and get you back to the life you love. If you found this first chapter enlightening, please like this video, share it with a loved one who is suffering, and subscribe to our channel. Your support helps us spread these life-changing medical insights to millions of people around the world who are searching for hope. Let's reclaim your health. Together.
My dear friend, it is a pleasure to reconnect with you as we continue our journey toward reclaiming your spinal health. In our first chapter, we pulled back the curtain on MRI myths and discussed the incredible biological potential your body has to heal itself. But now, we must address a difficult question. If our bodies are so capable of healing, why are so many people, especially here in the United States, stuck in a cycle of chronic back pain for years? Today, I want to talk to you about what I call the American lifestyle trap. This is the invisible cage of habits that sabotages your recovery, regardless of how many pills you take or injections you receive. Let's start with a story that I see almost every day in my clinic. Meet Mark. Mark is a 42-year-old data analyst living in Austin, Texas. He came to see me looking exhausted, clutching his lower back with a sharp pain radiating down his right leg, classic sciatica. He had tried everything, steroid shots, chiropractic adjustments, and every over-the-counter painkiller available. Nothing lasted. When I asked Mark about his daily routine, he sighed and said, "Dr. Beth, I sit in front of 3 monitors for 10 to 12 hours a day. By the time I get home, I'm so drained that I just collapse onto the sofa to watch TV until I fall asleep." Mark isn't lazy. He is a hard-working professional caught in the modern trap. You see, Mark was suffering from what the medical community now calls sitting disease. To understand why this is a disaster for a herniated disc, we have to look at the biomechanics of the spine. A landmark study conducted by Dr. Alf Nachemson, a world-renowned Swedish orthopedic surgeon, revolutionized our understanding of spinal pressure. He found that the pressure on our lumbar discs when we sit unsupported is 140% higher than when we stand. But it gets worse. If you slouch forward, which most of us do while typing or looking at a laptop, that pressure skyrockets to 185% compared to standing. For someone like Mark, who already has a compromised disc, sitting for 10 hours is like repeatedly jumping on a broken ankle. We often think of the spine as a stack of bones, but it's actually a dynamic, living system. Your discs are like sponges. They don't have their own blood supply. They rely on a process called imbition, a fancy medical term for drinking. When you move, the pressure changes, pumping waste products out and sucking fresh, nutrient-rich fluid in. When you sit still for hours, you are essentially starving your disc. You are cutting off the very supply line it needs to repair the tears in its outer ring, the annulus fibrosus. But the trap goes even deeper than just sitting. We are currently living through an epidemic of text neck. Think about how often you look down at your smartphone throughout the day. Your head weighs about 10 to 12 pounds in a neutral position. However, research published by Dr. Kenneth Hansraj, chief of spine surgery at New York Spine Surgery and Rehabilitation Medicine, showed that when you tilt your head forward at a 60-degree angle to read a text, the effective weight on your cervical spine increases to a staggering 60 pounds. That is like carrying an 8-year-old child around your neck for several hours a day. This relentless mechanical stress causes the discs in your neck to wear out prematurely, leading to herniations that cause numbness and tingling in your hands. Beyond the physical mechanics, there is a chemical side to this trap: chronic stress. In our fast-paced American culture, we are constantly in a state of fight or flight. This triggers the adrenal glands to release cortisol, the stress hormone. While cortisol is necessary for survival, having it flooded in your system 24/7 is toxic. Research in the Journal of Psychosomatic Research has shown a direct correlation between psychological distress and the presence of pro-inflammatory cytokines in the blood. When you are stressed about work or your mortgage, your body stays in a pro-inflammatory state, which means the fire around your nerve root, the one we talked about in Chapter 1, cannot be extinguished. Stress also causes your back muscles to tighten up as a defensive reflex, which further compresses your disc and limits blood flow. In Mark's case, it wasn't just the sitting, it was the high-pressure deadlines that kept his body from ever entering the rest and digest phase, where true healing occurs. We also cannot ignore the role of sleep, or the lack of it. In the U.S., we often wear our lack of sleep like a badge of honor, but for a patient with a herniated disc, sleep is your most powerful medicine. During deep sleep, the body releases human growth hormone, HGH, which is essential for tissue repair and protein synthesis. If you are only getting 5 hours of restless sleep because of pain or anxiety, you are skipping the only time your body has to rebuild the collagen in your discs. My dear friend, I share these facts not to overwhelm you, but to empower you. Most people think they are failing to heal because their body is weak. The truth is, their body is simply being overwhelmed by an environment it wasn't designed for. We were designed to move, to walk, to rest deeply, and to live in community. We were not designed to be hunched over glowing screens in a state of constant chemical stress. To break free from this trap, we don't need a miracle, we need a strategy. This is what I told Mark. We started with the 30-minute rule. For every 30 minutes he sat, he had to stand and walk for just 2 minutes. We raised his monitors to eye level. We introduced 10 minutes of diaphragmatic breathing before bed to lower his cortisol levels. Within 6 weeks, without a single new medication, Mark's leg pain began to retreat. His body started doing what it was always designed to do: heal. As you go through your day today, I want you to be an observer of your own life. Notice when you are hunched over. Notice when your breath is shallow. Remember that every small adjustment you make is a signal to your spine that it is safe to begin the repair process. You are the architect of your recovery, and I am here to provide the blueprint. In our next chapter, we're going to dive into the fascinating science of resorption, the process where your immune system actually cleans up the herniated material. It's one of the most beautiful processes in human biology, and I can't wait to share it with you. I'll see you in Chapter 3. Take a deep breath, stand up tall, and remember, your back is stronger than you think.
Chapter 3. The Science of Resorption, How Your Body Actually Eats the Herniated Disc. My dear friend, we have spent our first 2 chapters identifying the enemies of your recovery, the myths of the broken spine and the traps of our modern sedentary lifestyle. But today, I want to pivot towards something truly miraculous. I want to talk to you about hope. Not just a vague, optimistic feeling, but a hope that is deeply rooted in the biological reality of your own immune system. One of the most common questions I get in my office is, Dr. Beth, if the jelly has leaked out of my disc, where does it go? Does it just stay there forever, pressing on my nerve? The answer, which surprises many, is a resounding no. Your body has a built-in, highly sophisticated cleanup crew designed specifically to remove that herniated material. In medicine, we call this process spontaneous resorption. To help you visualize this, let me tell you the story of Sarah. Sarah was a 35-year-old middle school teacher and an avid hiker from Colorado. She came to see me in a state of absolute despair. Her MRI showed what we call a large disc extrusion at L4, L5. Basically, a significant amount of the disc's inner nucleus had broken through the outer ring and was sitting right on her sciatic nerve. She could barely walk to her classroom, let alone hike a trail. 2 different surgeons had told her that because the herniation was so large, surgery was her only option. Sarah was terrified of surgery and asked me, "Is there any other way?" I looked Sarah in the eye and told her something that sounds counterintuitive. "Sarah, the fact that your herniation is large might actually be a blessing in disguise." She looked at me like I was crazy, but here is the science. Research published in the prestigious journal Clinical Rehabilitation and meta-analyses in the New England Journal of Medicine have shown that the larger and more exposed a disc herniation is, the more likely the body is to resorb it. In fact, studies show that up to 66% of disc herniations can spontaneously regrow or disappear without surgery. How does this happen? It all comes down to a remarkable type of white blood cell called a macrophage. Think of these cells as the Pac-Man of your immune system. When the inner material of your disc, the nucleus pulposus, leaks out into the spinal canal, your body recognizes it as a foreign invader. It's not supposed to be there. This triggers an immune response. Your body sends out a signal, and an army of macrophages rushes to the site. These Pac-Man literally begin to eat and digest the herniated disc material. But there's a second part to this miracle called neovascularization. Because the area where the herniation is sitting now has access to blood flow, unlike the inside of the disc itself, new tiny blood vessels begin to grow into the herniated mass. These vessels bring in more cleanup cells and help the herniated material dehydrate and shrink. Over time, that jelly that was once pressing so hard on your nerve becomes smaller, softer, and eventually it can vanish entirely. In Sarah's case, we didn't rush to the operating room. Instead, we worked on creating the perfect biochemical environment for her macrophages to do their job. We focused on high-quality hydration because resorption requires a fluid exchange. We used specific low-impact movements to gently pump the area, and we transitioned her to a strictly anti-inflammatory diet to ensure her immune system wasn't distracted by other fires in her body. 6 months later, Sarah returned for a follow-up MRI. The results were stunning. The large extrusion that had terrified her was 80% gone. Her body had literally reabsorbed the injury. She was back on the hiking trails of Boulder, pain-free without a single stitch or incision. Sarah's story isn't a miracle. It's a classic example of matrix metalloproteinases, enzymes in our body that break down the proteins in the disc material, working exactly as nature intended. Now, you might be wondering, why doesn't this happen for everyone? The answer lies in the traps we discussed in Chapter 2. If your body is constantly flooded with cortisol from stress, or if you are dehydrated and sedentary, your Pac-Man becomes sluggish. If your blood is thick with sugar and inflammatory fats, the new blood vessels can't grow effectively to reach the herniation. Your body wants to clean up the mess, but you have to give it the tools to do so. This is why I often tell my patients that the pain they feel in the first few weeks is actually the sound of the cleanup crew working. Inflammation is the first step of healing. When you take massive doses of anti-inflammatory drugs immediately, you might actually be slowing down the very macrophages that are trying to save you. We want to manage the inflammation, not switch it off entirely, because that fire is what alerts the immune system to start the resorption process. My dear friend, I want you to look at your MRI report again, but this time look at it with a sense of wonder. That herniation isn't a permanent break in your back, it's a temporary situation that your body is already working to resolve. Your immune system is more powerful than any scalpel, provided you support it with the right movement, the right nutrients, and the right mindset. In our next chapter, we're going to talk about the fuel for this process. We will discuss exactly how to move and what to eat to turn your immune system into a high-performance recovery machine. We will shift from passive waiting to active healing. If Sarah's story and the science of resorption gave you a new sense of hope today, please like this video. Share it with someone who has been told they must have surgery. They deserve to know about their body's natural healing power. And make sure to subscribe to Goodbye Back Pain. We're building a community here in the US and around the world dedicated to science-backed, compassionate recovery. Your journey to a pain-free life is just beginning, and I am so honored to be your guide. I will see you in Chapter 4, where we talk about turning movement into your most powerful medicine. Until then, stay hydrated, keep breathing deeply, and trust the incredible wisdom of your body.
My dear friend, I want to start today by asking you a question that I ask almost every patient who walks into my clinic with a fresh MRI. What was the very first thing you did when the pain became unbearable? 9 times out of 10, the answer is, Dr. Beth, I went straight to bed. I stayed there for 3 days, barely moving, hoping it would just go away. It makes perfect sense, doesn't it? When we twist an ankle or break a bone, we immobilize it. We put it in a cast. We protect it. So naturally, we assume the spine requires the same absolute rest. But today, I need to share a truth that might feel a bit shocking, yet it is backed by the most rigorous medical science available today. Absolute bed rest is one of the most dangerous prescriptions for a herniated disc. In fact, in the medical world, we have moved away from rest and toward something much more effective called strategic movement. Let me tell you about James. James was a 55-year-old high school football coach from Ohio. He was a tough guy who had spent his life on the field. When he suffered an L5-S1 herniation, he decided to play it safe. He took 2 weeks off work and spent nearly 20 hours a day lying on his back on a firm mattress. He thought he was giving his disc a chance to heal, but when he finally came to see me, he wasn't better, he was significantly worse. His pain had intensified, his legs felt like lead, and he was beginning to show signs of clinical depression. What happened to James is what we call the deconditioning syndrome. When you stop moving, your body begins to shut down the very systems needed for repair. A landmark study published in The Lancet, one of the world's most prestigious medical journals, concluded that for low back pain, bed rest is not only ineffective, but can actually lead to longer-lasting disability. Here is the science behind why James got worse. Your spine is a movement-dependent structure. As we discussed in earlier chapters, your discs lack a direct blood supply. They rely on the pumping action of movement to stay hydrated and to clear out the inflammatory chemicals we talked about in Chapter 1. When James stayed in bed, he stopped that pump. The acidic jelly from his herniation stayed stagnant, irritating his nerve root without any fresh fluid to wash it away. Furthermore, we have to talk about your multifidus muscles. These are tiny, deep muscles that act like internal braces for your vertebrae. Research using MRI imaging has shown that these muscles can begin to atrophy or waste away within just 24 to 48 hours of inactivity. When James stayed in bed for 2 weeks, his internal brace disappeared. When he finally tried to stand up, his spine had no muscular support, causing the vertebrae to compress the disc even harder. He was essentially crushing his own injury because he was too protected. This is where strategic movement comes in. Strategic movement isn't about running a marathon or lifting heavy weights. It's about finding a pain-free range of motion. I told James the same thing I'm telling you now. We need to move to heal, but we must move with wisdom. In the United States, we often look to the work of Dr. Stuart McGill, a world-leading expert in spine biomechanics. His research emphasizes that we must stabilize before we mobilize. For James, our first strategic movement wasn't a complex exercise. It was simply walking. Walking is a natural pumping mechanism for the spine. We started with just 5 minutes 3 times a day. We used what we call the red light, green light system. Green light, movement that feels okay or slightly uncomfortable, but doesn't increase your radiating leg pain. Yellow light, movement that causes a temporary ache but settles quickly. Red light, any movement that causes peripheralization, meaning the pain travels further down your leg toward your foot. If you hit a red light, we stop and adjust. By using this graded approach, James began to desensitize his nervous system. You see, when you are in chronic pain, your brain becomes hypervigilant. It starts to interpret any movement as a threat. By moving strategically and staying in the green light zone, you're teaching your brain that it is safe to move again. This is a process called neuroplasticity, and it is a vital part of the roadmap to a pain-free life. I remember the day James walked into my office 3 months later. He wasn't walking, he was back on the sidelines coaching his team. He told me, "Beth, I realized my back wasn't a porcelain vase that was going to shatter. It was a rusty gate that just needed some gentle swinging to get moving again." My dear friend, if you are currently afraid to move, I want you to know that I hear you. That fear is real, and it is your body's way of trying to protect you. But I want to hold your hand and encourage you to take that first small strategic step. Whether it's a short walk to the mailbox, a gentle pelvic tilt in bed, or simply sitting up tall for a few minutes, every bit of movement is a signal to your body that the cleanup crew, the macrophages we talked about in Chapter 3, can keep working. Movement is the oil for your joints and the fuel for your discs. When you combine the anti-inflammatory environment we created in the previous chapters with the strategic movement we are discussing now, you become unstoppable. You shift from being a patient to being an active participant in your own biological miracle. In our final chapter, we're going to tie everything together. We will discuss the mindset of a healer and how to ensure that once you get rid of this pain, it never, ever comes back. We are going to build a fortress around your spine for the long term. If James's journey from the bed rest trap to the football field inspired you today, please like this video. Share it with someone who is currently stuck on their sofa, afraid to move. They need to hear that movement is their friend, not their enemy. And please subscribe to Goodbye Back Pain. Your support allows me to keep bringing this medicine of hope to people all across the country and the world. Let's keep moving forward, one small step at a time. I will see you in Chapter 5, the final piece of our roadmap. Until then, take a short walk, breathe into your belly, and trust that your spine was built for strength.
My dear friend, we have reached the final chapter of our journey together, but I want you to look at this not as an end, but as a beautiful, strong beginning. We have traveled from the frightening images of an MRI to the incredible biology of resorption, and from the trap of inactivity to the liberation of strategic movement. However, as a physician who has spent decades treating the human spirit alongside the human body, I know there is one final essential piece of the puzzle. Without it, even the best exercises and the cleanest diets can only take you so far. That piece is the mindset of a healer. I want to tell you about Robert. Robert was a 68-year-old retired architect from Virginia. When he first came to my office, he didn't just walk with a limp, he walked with a profound sense of fragility. He moved as if he were made of glass, terrified that one wrong step would shatter his spine forever. He had stopped gardening, stopped playing with his golden retriever, and even stopped hugging his wife with his usual vigor. Robert was suffering from what we in the medical field call fear avoidance behavior. You see, chronic pain doesn't just live in your discs. It eventually takes up residence in your brain. This is a scientific phenomenon known as central sensitization. A study published by the American Psychological Association and researchers at Stanford University found that the brain's pain map can become hypersensitive. When you are in pain for a long time, your nervous system lowers its threshold for danger signals. Even safe movements can trigger a pain response because your brain is trying too hard to protect you. Robert's spine had actually begun to heal, but his brain was still screaming danger at every turn. To heal Robert, we had to heal his mind. We had to shift him from a victim mindset, where the disc was a monster controlling his life, to a healer mindset, where he was the CEO of his own recovery. We used a technique called cognitive functional therapy. This isn't just positive thinking, it is a science-backed approach to retraining the brain to realize that the back is strong, resilient, and capable of handling load. As Robert learned to trust his body again, something remarkable happened. His pain levels dropped significantly, not because his disc changed overnight, but because his nervous system finally calmed down. He realized that a flare-up wasn't a sign of new damage, but simply a temporary alarm bell that he could silence with breathing and gentle movement. This is the first pillar of your fortress, resilience of mind. The second pillar of your fortress is spinal hygiene. Just as you brush your teeth every day to prevent cavities, you must care for your spine every day to prevent the recurrence of herniation. Prevention isn't a 12-week program, it's a lifestyle. I often refer my patients to the Big 3 exercises developed by Dr. Stuart McGill, which focus on building core stiffness, the ability of your trunk muscles to stay rock solid to protect the spine during movement. Scientific data from the Journal of Biomechanics shows that a strong muscular corset can reduce the shear force on your lumbar discs by over 40%. For someone like Robert, this meant learning how to hip hinge when he reached down to pull a weed in his garden, rather than rounding his back. It meant maintaining his golden diet, those anti-inflammatory foods we discussed, to keep his systemic inflammation low. In the U.S., we are surrounded by convenience that encourages poor posture and poor nutrition. Your fortress is built by the small, disciplined choices you make in the face of that convenience. Robert recently sent me a photo. He wasn't in a clinic, he was standing in his garden, holding a massive basket of tomatoes with his dog at his side. He looked 10 years younger. He wrote, "Dr. Beth, I realized I'm not an old man with a bad back. I'm an athlete in training for the rest of my life." My dear friend, that is the vision I have for you. I want you to stop seeing yourself as injured and start seeing yourself as in training. Your body is a masterpiece of engineering. Your discs have the capacity to resorb, your nerves have the capacity to heal, and your brain has the capacity to unlearn pain. As we close this roadmap, I want you to remember that healing is not a straight line. There will be days when you feel a twinge or days when you feel frustrated. On those days, I want you to come back to these lessons. Reread the science. Remember the macrophages. Remember Mark, Sarah, James, and Robert. You are part of a global community of people who are refusing to let back pain define their future. I have spent my life's work trying to bring this message of hope and science to as many people as possible, but I cannot do it alone. I need your help to spread this medicine of hope. If you have found strength and clarity in this series, please like this video to help the algorithm show it to others in pain. Share this final chapter with someone who feels fragile or hopeless. You might be the reason they decide to stand up and try again today. And most importantly, subscribe to our channel, Goodbye Back Pain. By subscribing, you are joining a movement of thousands who are choosing evidence-based healing over fear. Let's continue to build this community together, supporting one another until every one of us can say goodbye to back pain for good. Thank you for trusting me with your journey. Stay strong, stay moving, and always remember, your greatest healing power lies within you. With my deepest warmth and unwavering hope, Dr. Elizabeth Reed, Beth.